Well, good morning and welcome to the 2020 Shift Summit. So if you are joining us here today, come on in and use that handy chat feature at the bottom of your screen to introduce yourself. Let us know your name, where you're watching from today, the organization that you're with, and whether you plan to vote early in this year's election by absentee ballot or in person on November 3rd. Regardless, we do encourage you to vote. And so a note to all participants, most portions of this year's summit will be recorded for later distribution. If you do not wish to be recorded, you're kindly asked not to participate in these elements of the 2020 Shift Summit. So my name is Christian Beckwith. I'm the Executive Director of Shift. It is my pleasure to welcome you to this year's program. We are broadcasting virtually from Jackson Hole, Wyoming, and we'd very much love to have you here with us today. The mountains are covered in snow. We have some very dark and powerful storms moving in over the mountains. Unfortunately, we, along with the rest of the world, are adapting to our new reality, but we're very glad that you have joined us virtually here this morning. And before we get going, I would just like to thank our sponsors who have made this year's program possible. In particular, our presenting sponsor, All Trails, who is also the presenting sponsor of our Shift Health and Nature webinar series, along with the National Park Service this year. All Trails, thank you very much. Christy Walton, the Esther and Otto Seligman Foundation, the VF Foundation, Patagonia, the Cliff Bar Family Foundation, Wellbeing Trust, 1908 Brands and Boulder Clean, Ravana Designs, the Laura L. and Martin N. Kelly Family Foundation Trust, Marcia Kunstel, and Kirtan Management Solutions. I would also like to thank our board of directors, in particular our board chair, Frederick Reimers, who's been carrying our organization for 3 years now, Mickey Fern, Dr. Suzanne Bartlett Hackenmiller, Sandy Schultz Hessler, Jess Saba, Gerben Sherpier, Tanner Yes, and Julie Williams. Thanks to all of you for making this so possible over the course of this year and the preceding years as well. And as always, we owe a debt of gratitude to our team. So in particular, Dr. Morgan Green, Director of the Emerging Leaders Program, who consistently goes above and beyond his duties with ELP to enrich our entire organization. And we're equally indebted to Arian Davis, our project manager, and Meredith Davison, our marketing consultant, for their assistance throughout this past year. They've made much of our work possible. They're working as contractors. They're taking on duties and tasks far beyond their scope of work, working remotely in different time zones, and none of us have actually ever met in person. And they are managing small children during a global pandemic that is expected to force 1 in 4 women to leave the workforce. So thank you all for making this possible. And thanks to the Zoom magic that's being facilitated by Arian and Meredith, along with a host of volunteers. Over the next 3 days, we'll be focusing our attentions on the mental health benefits of time outside. We'll also be exploring barriers to those benefits and the ways that we can lessen and remove them. So, the 2020 Shift Summit. We've got 3 main goals for this year's summit, and they are consistent with the goals that we have for every summit. The only difference is this year we're trying it virtually, so please work with us as we make this virtual magic happen. The first objective of every shift is to facilitate networking and collaboration across disciplines among folks that we know are natural allies, but that otherwise might never have the opportunity to interact. The second is to showcase best practices, and this is work that we know to be impactful, innovative, and replicable. And then we're attempting to translate the evidence for the mental health benefits of nature contact into both practice and policy. So the program will be developed, as it always is, around 2 elements that are integral to these objectives. The first is the 2020 Shift Award winners. So this is work that we've identified around the country and then evaluated on the basis of innovation, impact, and replicability. And this is the best work that we've found this year among all our nominees. And then, of course, fellows of the 2020 Emerging Leaders Program, which prepares early career leaders to address issues related to public health, conservation, advocacy, structures of oppression, and community engagement. So both the fellows and the Shift Award winners are central to our work. You'll have plenty of opportunities to meet them over the course of the next 3 days because we build the programming to highlight their work. The programming itself will unfold as follows. So today is day one of this year's Shift Summit, and it's focused on research. So the evidence for the mental health benefits of nature contact. Day two, tomorrow, we're moving into the boots on the ground work that takes that evidence and translates it into practice. And so a lot of that work is represented by our Shift Award winners and our emerging leaders. And it is truly exceptional, which is why we're including it. But that also brings in day three. How do we move such work from being the exception to being the norm? Day three will thus focus on the ways that we can center the mental health benefits of nature contact within policy at the community, municipal, state, and federal levels. So within each of the 3 days, the summit will be divided into 3 tracks. Next generation will focus on the mental health benefits of nature contact for children, teens, and young adults. Psychological resiliency will focus on nature contact as a mechanism for healing and enhancing mental health. And resource management will look at the ways that natural resource managers can position our parks, our forests, our waters as mental health care delivery systems, removing barriers to access for vulnerable populations in the process. So all of this is occurring, as we're all very well aware, within the context of a convergence of crises unlike any we've ever experienced. So COVID-19 has laid bare the vast systemic inequities of our country, inequities that extend from the environment to the foundations of our infrastructure to individual health outcomes. The ongoing murders of Black Americans have placed our institutionalized racism in stark relief. Never has it been so abundantly clear. There is no separation between social justice, environmental justice, and public health. And that is why we're not just focusing on the mental health benefits of time outside with this year's program. As an American, as we're all so well aware by now, your zip code is a greater indicator of health outcomes than your genetic code. Those among us with the greatest health disparities are often the same people who have the least amount of access to quality public spaces. So we'll be talking about this a lot over the next 3 days, as well as the ways we can engage our communities in the process of shaping our parks, our trails, our gardens, so that nature's healing is available to all of us, regardless of race, class, where we live, or the color of our skin. And this is not easy work, and we're tired. We're stressed, we're threadbare, we're afraid. 12% of respondents to our pre-summit survey reported that they've lost their jobs, been furloughed, or had their hours reduced. 30% indicated the organization they work for has lost 25% or more of its funding, as is the case with our organization. 42% report that their organization has cut programming. And 53% report that challenges associated with working from home and shelter-in-place orders have reduced their output or the output of their organization. This is the reality of our country today. And it's a reality that's harder for some than for others. And in response, wherever possible, we're turning to nature for solace in record numbers. People going outside, as we know, is a good thing. It reduces medical costs, it increases cognitive performance, lowers cortisol levels, and offsets social isolation and loneliness, health conditions that are increasingly recognized as economic, psychological, and social strains on our individual and national well-being. For those with safe access to natural spaces, time outside is delivering mental health benefits at the precise moment that they're needed. For millions of others, though, racial and economic barriers prohibit access to those same places. These barriers exist the most in vulnerable communities where the need is greatest. That, too, is part of this year's program. For nature's benefits will only be fully realized when access is there for all of us. And there is something else that we need to talk about and think about as well. It will not be enough for us to simply get more people outside and to love nature more. We're already loving it to death. What is required of us now is to return to an older way of interacting with nature that is respectful, and that needs to be in place for to successfully navigate the next 100 years of life on this planet. As more of us go outside, the lands and waters where we're recreating are seeing greater degradation. We are society's children. Our approach to the natural world is the same as our approach to pretty much everything else. We take, we consume, we extract solace and happiness and fitness and adventure from our time outside. But what are we giving back? It's not enough to ask the natural world to take care of us. We are nature. We can only be as well as the nature in which we live. We need to embrace a reciprocal relationship with the natural world and its inhabitants that honors the fact that we're part of the same ecosystem. Only by reimagining how we relate to nature will we be able to step into our full potential as healthy citizens in a healthy world. And ordinarily, I'd say that's a tough order, but these are not ordinary times. This is the greatest crisis of our lives. We must not let it go to waste. Past pandemics have ushered in seismic social change. The Black Plague gave us the Renaissance. The Spanish flu created the foundations of our social welfare net and our modern healthcare system. The overall objective of this year's summit is to harness the unprecedented opportunity created by the unprecedented convergence of crises to center nature and equitable access to nature and a reciprocal relationship to nature more robustly in all of our lives. And you're the people to do it. You're the researchers, the practitioners, the policymakers, the outdoor recreationists, the healthcare providers, the land managers, the conservationists. Over the next 3 days, as we explore the evidence and the ways that evidence is being translated, and work on ways to ensure everyone has safe access to our natural spaces, think too of the ways we can make that relationship flow both ways. We can do this. Reciprocity was the cornerstone of our relationship with the natural world for tens of thousands of years. The blueprint's there, the timing's right, and it will take an intentional effort on all our parts to restore it. So now I would like to welcome our first speaker of the 2020 Shift Summit, Dr. Lisa Fitzpatrick. Dr. Fitzpatrick is an infectious diseases physician, a CDC-trained medical epidemiologist, and founder of Grapevine Health, which is an organization focused on improving health literacy and patient engagement. Her career has spanned research, clinical medicine, global health, community health education, and patient advocacy. Most recently, she served as the medical director for Washington, D.C.'s Medicaid program. Dr. Fitzpatrick is a professorial lecturer for the George Washington University Milken Institute School of Public Health and an adjunct clinical professor at the George Washington University School of Medicine. She's an Aspen Institute Health Innovator Fellow and member of the Aspen Institute Global Leadership Network. She has a master's in public health from the University of California-Berkeley School of Public Health, and a master's in public administration from the Harvard Kennedy School of Government. In addition to public health and infectious diseases, Dr. Fitzpatrick's areas of professional interest include health literacy, patient engagement, and health innovation for underserved communities, specifically digital health solutions. And what I've been delighted to realize is that Dr. Fitzpatrick is a bona fide nature fiend, which has made our conversations over the past 6 months a lot more fun. So we're going to play her presentation, which she has pre-recorded. She is with us here today. She's watching the proceedings right alongside you. So feel free to engage directly with her using your chat feature. If you have questions, please drop them in the Q&A feature, and we'll answer them live after her presentation.
Good morning to you. And to Christian and all the organizers of this event, thank you for inviting me to open the conference. I'm honored I was asked to speak about how to leverage this historic moment for positive social change. It's a really awesome question. During this pandemic, health and social disparities and social injustice have been placed squarely on America's radar. And it is indeed time for a positive social change. I believe for those of us who love and appreciate nature, it's a time for us to lead a new conversation about nature as medicine. It's an opportunity to rebrand nature as the unifier and healer that it is for everybody. But first, I want to talk a bit about what we've learned from this historic moment. The social disparities highlighted by the pandemic are in plain view. The infection and death rates are higher in Black and Brown communities. And we know life is harder if you're poor because you're more likely to be an essential worker or find it harder to practice social distancing, both at home and in the community. There's also fear of entering healthcare institutions right now. And we are seeing unprecedented distrust of science. And although the science shows us right now, one of the safest places to be is outside, many people I talk to are too fearful to even leave the house. Our usual response to bad news like this is to spring to action by proposing and conducting research, analyzing data, writing reports and manuscripts, conducting policy briefings or listening sessions. And this, I'm showing you an example because from my work, we often spring to action when we hear about social disparities or health disparities, and we create pretty documents and reports like the one I'm showing here. And these things remain essential, but I believe this moment pause for something different. But what is the social change we need? And in calling for change, how can we ensure we are not leaving people behind? This is my greatest concern about equal access to nature that is healing, because in so many places and in people's experiences, nature is a place of trauma rather than healing. And in thinking about how to bring everyone along, I sent this text message to my mother asking her why Black people don't spend time in nature. And you can see her sobering response. She said, because we spend so much time in the open, outdoor, and in the fields, the hot sun, rugged elements, and uncomfortable conditions as slaves and sharecroppers. Don't be hard on us. I started in the fields around 5 years old, dodging snakes, bugs, mosquitoes, and Lord knows what else. I was too glad to get away from nature and the open outdoors. It's pretty sobering. Also, I live in an underserved neighborhood, and for years I've tried to create community walking or outdoor exercise groups and have largely been unsuccessful. So this is a common scene. This is a photo I took walking in my neighborhood just a few days ago. The weather was beautiful, the trails are beautiful, but where are the people? I'm often told how brave I am to walk in my neighborhood, especially if I'm by myself. Can you imagine what that's like? It's become clear to me, zip code matters. And we don't all have equal access to nature. Nature should be a safe space for rejuvenation, stress relief, a place to find clarity and peace. But in so many of our neighborhoods, including my own, nature is not widely cherished as a safe space because many of them are rife with violence, even in the daytime. And at a time when nature can offset mental distress imposed by the pandemic, being outside should be a reprieve, an ideal opportunity to practice social distancing. So why are these trails empty? And take a look at this chat. These are recent entries on my neighborhood group chat. The frequency of daytime violence overrides interest in being outside. Someone's commenting on the heavy artillery sounding like a war zone. And other people later chimed in about whether or not they should consider moving because the neighborhood is too stressful. And what about the homeless? If you live outside, how might you react to the suggestion that nature is healing? And if our message is that nature is an antidote for stress, trauma, physical and mental illness, is there adequate access to nature for the homeless? Why do they sleep under bridges and not in green spaces? I'm told it's perceived as safer because people are around. And these photos are from a federal park and green space just a few blocks from my house. Does it look healing to you? Does it feel like a refuge? During the pandemic, there have been at least 3 shootings within 1 block of this park. I raise these issues for awareness as we consider approaches to providing equal access to nature. How do we leverage this moment to achieve broader awareness about the healing power of nature, even at a time like this, with perceptions and past experiences like those I'm sharing? But what if we could reintroduce or rebrand nature as a healer, nature as medicine? To address these concerns and change the perceptions about nature, I believe we have to solve for exposure or awareness and belonging. Many of you know this organization, One Common Unity. Their work is about just that, educating young people, exposing them to nature, and ultimately offering them a place to belong in nature. Do you recognize me in these pictures on the left? These photos are taken on my first trip to a national park. I was 21 years old. In fact, other than a car trip from Missouri, I was born in St. Louis, born and raised in St. Louis. This car trip from St. Louis to Memphis when I was 5, it was my first time leaving Missouri, and I didn't leave again until this trip. The men in the photo are my college classmates, and they invited me to go with them to the Grand Canyon. But the education and exposure I received from them and that trip led to a life of exploration, travel, and further appreciation for nature all over the world. And over the years, I've learned nature is medicine, it is healing. And for me, nature brings clarity, peace of mind. It's a parasympathetic stimulus that counterbalances the physiological impact of chronic stress, not just for me, but for anyone. I learned over the last few decades, nature is a unifier. How can we capitalize on that? The impact nature had on me made me eager to introduce young people to nature. So the photo on the right was taken around 2001. The young lady was my mentee in a Big Brother, Big Sister program. One day I decided to take her to the Oakland Hills. I lived in Berkeley, California at the time. And I told her we were going to the park. We drove to a bluff, got out of the car, and she took in the view for a few minutes, and then she turned to me and said, "I thought you said we were going to the park. Where are the swings?" I told her it was a different kind of park, but she'd never left her neighborhood. She stared at the view, and then we both sat down, and sitting together in silence, after a few minutes, she said, "It's so quiet." I watched her and realized she was the most relaxed I'd ever seen her. A few weeks later, she inquired about when we go back to the park. And in the picture here, I took her to a farm. I had a friend who lived on a farm out in a rural part of California, and she loved it. And as you can see, she found her swing. There are thousands of kids like her, craving exposure to what nature has to offer. How can we offer all children in underserved communities exposure to nature? How can we make millions more children aware of its healing qualities? But in addition to exposure and awareness, we need to offer a sense of belonging. As you saw in my mother's text, a mention of nature conjures many negative associations, but many people also feel they don't belong or are not welcome. I've often been the only Black person in a national park, or even in a neighborhood park. This recent op-ed in the Washington Post by Carrie Ann Hamilton highlights this point. She says national parks can feel lonely for people of color. Recently, someone described for me the difference between diversity and inclusion as being invited to the dance, diversity, versus being asked to dance. And the latter is how I see belonging. Have you ever felt out of place somewhere or like an other? Why did that happen? And what would make you feel as if you belonged in that situation? And if you've never experienced this, think about how much you have to offer so many people who feel they don't belong. I believe we can ensure equity and access to nature by addressing both exposure, increasing awareness, especially for our young people, and belonging. Exposing our young people to nature early and often, as shown on this slide, the top right slide is a picture of Atia Wells's backyard base camp. You'll hear more from her later in the conference about her efforts to do just that, increase belonging and exposure and awareness for young people and the Black community. We need so many more programs like that. But images and representation matter. And that's the point of this slide, to show how simple gestures, such as showing images of Black and brown people, whether it's on your website or your pamphlets, or in the ways you communicate about what your organization does. These simple gestures are often overlooked, but they are interventions that foster belonging and inclusion. Now, I know I've posed a lot of questions, and I hope you will consider them as this conference progresses. But I'd like to raise awareness about one potential solution. Since so many of you are connected to philanthropy and giving, either as grantees or grantors or funders, for a minute, I want to talk about the need to shift the culture and approach to funding. Most organizations committed to improving equity and access to the benefits of nature are nonprofits. And these nonprofits struggle to scale and achieve needed impact, largely due to the culture of funding. I can speak to this firsthand. I started a nonprofit, and much to my dismay, I realized I couldn't get funding unless I had funding. So traditional grant funding is often a barrier to scaling these efforts. There are so many programs that are focused on some of the solutions to belonging, inclusion, exposure for underserved populations. There are urban camping programs, outdoor education, nature-based trauma therapy, taking people out of their neighborhoods. So the neighborhood I showed you, my own neighborhood, we need programs that take people from their neighborhoods and show them alternatives, similar to my approach with my little sister. But if the grant funding is piecemeal, short-term, and non-renewable, it jeopardizes the success of organizations committed to a social justice mission like Nature is Medicine. And a lot of the companies and organizations that focus on these programs, the funding structure can be very limiting. And we will likely never scale the benefits of these great programs or even your research and community offerings without sufficient resources. So this is why I bring attention to trust-based philanthropy, the central tenet of which is the grantee and the community know much more about solving problems and should thus be given funding with limited strings attached and flexibility to operate as needed to get the work done. I think it's a fairly new concept, which I hope legacy foundations will embrace one day. But I believe we have to push for the change. I'm also curious to hear if you've heard of trust-based philanthropy, what your thoughts are about it, and how we can advocate for more of this. Finally, if we want to rebrand nature as medicine, as an equitable and accessible healer, we have to openly talk about the pain nature has caused communities of color. For many people, forests are associated with danger and isolation. Remember Harriet Tubman using nature, forests, and secret passageways to help people escape slavery. Some of you may be thinking, but that was so long ago. It wasn't. And for Black people, it's a painful history that passes from generation to generation. I think similar stories and experiences can be told for our Native American or Indigenous people. And even now, we have a present day example of how the legacy of injustice is affecting our fight against the coronavirus. The legacy of Tuskegee has been discussed more during this pandemic than I can recall in my 30-year career as a doctor. It's because the history matters. And if we want to move forward, we have to rebrand the story and the experience. I believe it's possible to rebrand nature as a healer that is accessible and welcoming to everyone. But our work, our intention, they have to openly reflect our understanding and acknowledgement of the trauma that's kept so many people disconnected and isolated from its healing powers. This pandemic seems to be never ending. We don't know how much longer coronavirus will be with us, and we can be sure the social and racial injustices that stain our society won't dissipate overnight. But as we build, organize, and create the just society we want, let us evangelize with our communities that nature is medicine. And let us lean on nature to sustain us and heal us as we do the important work that needs to be done. Have a great conference, and I thank you for listening.
Dr. Fitzpatrick, good morning.
Good morning, Christian.
Thank you for joining us in this this virtual manner. We sure do wish you were here. And
man, you can't imagine how much I wish oh my goodness, I can't even talk about how much I wish I were there.
Yeah, we'll have to rendezvous in the desert instead. So thank you so much for that presentation and for being part of our family over the course of the past 6 months. It's been an awful lot of fun to interact with you and get your insights and observations. And we just wanted to get to a few questions here.
Okay.
Let's see if I can actually call them up. Hold on one sec.
And congratulations to you for pulling this off, Christian.
Knock on wood. Up to the races, but we're not at the finish line yet. Thank you.
Well, at least you got started. How about that?
Yeah, that's always the hard part. So we've got a good question from somebody that says, how do we increase representation, that is the showing of photos of Black and brown people in our publications without risking tokenization?
Oh, wow. That's a fantastic question. Thank you so much for whoever asked it, because it's a real thing. This is about authenticity. People will be able to tell if you're being authentic. If you have, let's say you have a brochure and you have 10 white people, one Hispanic person and one Black person, but the person shows up to your organization or some of the activities offered by your organization, and they don't feel comfortable, they don't feel they belong, as I mentioned in my talk. This is an example of why people might feel tokenized. So I think if the leadership and the people working for the organization are embodying these principles of inclusion and belonging throughout their work, not just via brochures and even on the website. I think having testimonials from people who have engaged with the organizations or the activities, I think there are many ways to show the authenticity of that relationship. And people will be able to tell if this is something that's just for show or if it's something they built overnight. So I think that's a fantastic question. Thank you so much for putting it on the table, because it happens a lot.
Yeah, and we've got another one from the Council to Advance Hunting and Fishing. How can we separate the fieldwork idea that your mom mentioned from nature, or can we? They go on to say, I've also heard this from BIPOC friends when I ask them to go out into nature with me.
Yeah, very, very common. I get that as well when I ask even some of my friends and loved ones about this. I think nature can be tailored, the experience can be tailored. I would never take my mother camping. And once I made the mistake of taking her to a redwood forest. She does not like windy roads. We were out in Northern California, and the road to get to the trees was very windy. So she felt as if she was suffering because she was terrified on the windy road. So when we got to the trees, I thought, well, she'll be fine once she sees how beautiful it is. And she got there and she said, you brought me all the way up here to see trees. So I recognized for her specifically, I had to be very mindful about the nature associations for her. So I took her to a spa in nature. My mother loves spas. And there are plenty of ways to introduce people based on what they have affinity for, what they make positive associations with. So luckily, nature isn't monolithic. And there are ways to introduce aspects of nature based on who you're talking to. In fact, as I'm saying this, I feel like this is a great idea for a startup. So if there's someone listening, maybe there's an idea there.
Thank you. We always like the idea. That's what Shift is really all about, is bringing together this cross section of stakeholders from all over, and enriching conversation with the cross-pollination. So
yeah, I just had another idea though. Some of my friends who are really into fitness, there are many holidays people can take that are really focused on fitness, but they're also touching on nature, or maybe they're in the mountains or they're at retreat sites that are very beautiful. They're not focused so much on nature, but they're focused on the thing the person wants to engage with, like exercise. So I think there's a lot there.
Thank you. We've got another one. How do we listen and learn to shift the storyline for BIPOC communities without putting the burden on the already disadvantaged?
Can you repeat that, Christian?
How do we listen and learn to shift the storyline for BIPOC communities without putting the burden on the already disadvantaged?
So it's interesting. I do a lot of listening, especially now. You mentioned I started a company, Grapevine Health. All we did for a year was listen to people. And it actually unburdens people when you listen to them, or at least that's been my experience. So I would love to hear a bit more about the nature of this question, where it's coming from, because I think, again, authenticity matters. So if you're going into a community because you want to establish a long-term sustainable relationship, people can tell if you're being authentic or not. So if you're asking questions and you really want to hear the answers, people will engage with you and won't feel burdened. People sometimes feel burdened when people come into their communities, ask lots of questions, and then they leave and you never see them again. That happens a lot. It happens way more than it should. So maybe that's part of the question. But if there's an opportunity to get a follow-up, I would love to hear from the person who asked the question, why is the perception that the community is being burdened?
And that's another thing that we'll be discussing throughout these next 3 days. So this is a very dynamic and fluid conversation. And we're looking forward to the participation of all the folks with all their different perspectives and insights. That's where the richness comes. And Dr. Fitzpatrick, you previously talked about nature as a social determinant of health. How does that relate to your observations about nature as medicine?
Yeah, I think nature should definitely be categorized as a social determinant of health. There's so much overlap between the chronic health conditions, or the reasons we're seeing people with chronic health conditions, and even the stressors we're seeing now imposed by the pandemic. I think if we can educate people about why we need to integrate nature as a healing tool in our arsenal. I think in the United States, we are quite far behind when it comes to adopting principles associated with integrative medicine. But I think this has to become part of our lexicon in medicine and health, along with talking about how we support people, whether they need better housing, whether they need food support, transportation to see healthcare providers. Nature has to become an integral part of our social determinants of health lexicon. So thanks for asking.
Yeah, thank you. We've got time for one more. And we've got one from Dr. Morgan Green. He is the director of our Emerging Leaders Program. Good morning, Morgan. And Morgan is also a pediatric hospitalist. He says, I run into a lot of barriers in expanding representation, specifically in promoting and uplifting people of color in leadership positions. Some of the wording I run into are not the right fit. What mental framework have you seen work for organizations hiring representative leadership in the outdoor nature space and beyond?
Unfortunately, I don't have a lot to offer, and that's a testament to how much work we still have to do to increase diversity in our leadership C-suites, on boards, on policy-making bodies. Unfortunately, this is about education and exposure as well. So I talked a lot about that in my talk, but I think when we look at the lack of diversity in leadership across sectors, not just in healthcare, it demonstrates the systemic bias. And we all harbor bias of some sort. Bias comes from our experiences and the way we are raised in the environments we're in, but it's up to us to become educated and move beyond that, to see greatness and brilliance wherever it resides. So I'm sorry I don't have a great answer for the young leader, but apparently he's on the right trajectory.
I hope at some point you have a chance to meet. I think you'll enjoy his company as we do. We'll squeeze one more, and I'm going to try to combine two, one from Mary Berman and one from Joe Burns. So Mary Berman asks whether you can tell us a little bit more about the work that you're doing with Grapevine Health and any work that it's doing in relation to nature. And Joe Burns wonders if you're prescribing nature or outdoors or physical activity to your patients.
Well, I'll answer the second question first. It's interesting you're asking this question now because I've just kicked off the Walk with the Doc program here in DC 2 weeks ago. And for those of you who might be on here with Walk with the Doc, they send you a kit, and in the kit, they actually have prescription pads so that you can do just that. But even without the resources and support or the infrastructure of Walk with the Doc, this is a common recommendation I make for all my patients. It's the reason I started the nonprofit I mentioned in my talk, because so many of my patients said it's too expensive to exercise, or I don't feel safe exercising outside. So we created this nonprofit to give our patients and the community a place to go for free or very low cost exercise. With respect to Grapevine Health, since we're probably out of time, I don't want to talk too long about Grapevine Health, but invite you to go to our website, grapevinehealth.co. You can find us on all the social media channels. We also have a podcast. You can get the podcast anywhere you listen to podcasts and just type in Grapevine Health. But Grapevine Health, the purpose is to make health, the language of health, healthcare, less intimidating. And I started it because many years ago, I was speaking on a panel and a gentleman walked up to me. He must have been 60 or so. And he said, how does someone like me access someone like you on a regular basis? He was craving someone who spoke simplistically about healthcare to help people understand how to engage in their own health. And it's something I haven't seen for underserved populations. So I thought Grapevine Health could add value. So we're mostly in Washington, DC, but we just finished a road trip. We went to Newark and Philly with Dr. Lisa on the street. That's me. You can see those videos on YouTube as well. So the company's only about a year old. We're just getting going. So follow along. And if you have more questions, just reach out to me.
Thank you, Dr. Fitzpatrick. It's been wonderful to have you in the health and nature conversations we've been having over the course of the past 9 months. And we look forward to continuing them with you and with all the members of the health and nature movement in the years to come.
And I appreciate you having me. It's such an honor to open your meeting. And I can't wait until next year and come to Wyoming.
I know. Come on, vaccine. Okay, thanks. All right, so now we're going to jump into day one, and day one is our research. And the way that this is going to work is we have 3 different panels going on. The panels will begin each workshop, panel discussions. And so those are beginning at 9 o'clock, so the top of the hour. Following the panel discussions, participants and panelists will be placed in breakout rooms in smaller groups to continue discussing the topic using World Cafe format. So this is what we do at Shift. We get everybody with a panel discussion to frame up the topic, and then we break into these smaller groups so that we can all provide our insights and our experiences and our ideas to enrich the conversation overall. So we're building that into the virtual format here today. The final 30 minutes of the workshop there'll be 30 minutes where we have what we call the roundup, where the panel and the moderator, panelists and the moderator come back in the room along with the other breakout room hosts and talk about what they heard during the World Cafe sessions. And then the final 30 minutes will be focused on what do we do with this? What are the next steps based on this? So now we have time for a quick break. You have received an email from info@shiftjh.org that contained a link to these opening remarks. In the same email, there's a link to your panel discussion after your break. Click the link and you'll be admitted at the very top of the hour. Do be prompt. We are starting on time, and please remember to vote. Thank you, and see you back here in just a bit.